The key with glaucoma is to detect the increased intraocular pressure as soon as possible and immediately act to counter it before stronger prescription drugs or invasive surgery become necessary. Researchers have recently discovered a pair of nutrients that target the underlying mechanisms of glaucoma. If clinical signs like increased intraocular pressure have already developed, but there's still no noticeable symptoms, it's even more important to act quickly to prevent the disease progression. In this case, natural therapies, when combined with standard glaucoma medicines, might act synergistically to lower the intraocular pressure. Natural ingredients can also counteract the underlying damage caused by the glaucoma. Human studies have shown a powerful effect of French maritime pine bark and bilberry extract on the underlying symptoms of glaucoma. These two nutrients are rich in proanthocyanidins, powerful antioxidants known for their ability to neutralize harmful free radicals. Proanthocyanidins have also been shown to support cardiovascular health. In 2010, a study combining the treatment with French maritime pine bark and bilberry with the traditional glaucoma drug lantaniprast, a prostaglandin analogue that increases aqueous fluid drainage. The researchers found a clear benefit of the combination treatment. Pine bark and bilberry might act on a molecular level to decrease the production of aqueous humor, to improve blood vessel structure and function, and decrease the resistance to the fluid drainage. Lantaniprast causes smooth muscle cells, such as those in the blood vessels and the eyes, to relax or contract. However, in part due to the risk of the side effects associated with its use, the lantaniprast eye drops might not be ideal for people with elevated intraocular pressure without symptoms. By contrast, the natural intervention of the French maritime pine bark and bilberry is not associated with the side effects of the lantaniprast, which include ocular cysts, swelling, and inflammation. In this study, the researchers studied 79 patients who had elevated intraocular pressure, but with no signs of glaucoma. The patients were randomized to receive either an oral nutrient compound containing standardized French maritime pine bark extract and a phenolic bilberry extract, standard medical therapy with lantaniprast eye drops alone, or the nutrient compounds and the lantaniprast drops for 24 weeks. Intraocular pressure improved in the patients in all treatment groups. The most rapid drop in the pressure, 28%, was seen in the lantaniprast-only group, beginning 4 weeks after the treatment began. In Group 1, significant improvements began at 6 weeks. The intraocular pressure reduction was 24% at week 16 and was maintained throughout the study. The most exciting results, however, were in the group receiving the lantaniprast in combination with the pine bark and bilberry. The patients in this group showed a 28% reduction in the pressure at 4 weeks. Their reduction soared to 40% at 24 weeks. These results show the natural intervention amplifying the effects of the conventional treatment. Pine bark and bilberry are among the newest nutrients used to fight glaucoma, but research has long supported the use of antioxidants to counter the oxidative damage caused by the glaucoma. Dietary antioxidants have been shown to protect the retinal ganglion cells against damage. Antioxidants include glutathione, lutein, zeaxanthin, zinc, vitamin A, vitamin C, vitamin E, beta-carotene, bioflavonoids, e.g. CG from green tea, and curcumin. Lab studies show that antioxidant treatment helps to mitigate the risk factors for glaucoma. Research into the EGCG, or epigallocatechingallate, a powerful antioxidant found in green tea, for example, shows a potential impact on the physiology of the retinal cells in the patients with glaucoma. The researchers used electrical measurements of the retinal activity to show this effect. Most scientists agree that more research is needed to understand the role of antioxidants in preventing or treating glaucoma, and to determine the effect of different doses and combination of antioxidants in food and supplements. Vitamin C and bioflavonoids in combination, for example, are thought to preserve the structure and the function of blood vessels, and this can improve the blood flow to the retina and the optic nerve and prevent glaucoma or slow decline in vision. Vitamin C is also used in the formation of collagen, and this gives strength and structure to tissues in the body. In the eye, collagen helps to maintain the integrity of blood vessels and the trabecular meshwork. A recent study found vitamin C serum levels were significantly lower in normal tension glaucoma patients than in healthy controls. Vitamin A is necessary for the formation of rhodopsin, a pigmented compound in specialized retinal cells, which allow the eye to see in low light. The eyes are strong indicators of a vitamin A deficiency, becoming dry, itchy, or inflamed, and experiencing night blindness when the levels are insufficient. Almost anyone who's taking a multivitamin will not be deficient in vitamin A. Vitamin A can be obtained through food, such as green leafy vegetables, liver, kidney, egg yolks, butter, fortified dairy products, cod liver oil, and orange-colored food, for example. Or supplemental beta-carotene can also be used. Beta-carotene is pro-vitamin A. It's converted as needed into vitamin A in the liver or during intestinal absorption. Ginkgo biloba extract has been studied as a neuroprotector of retinal ganglial cells in glaucoma due to its ability to open or dilate the blood vessels and also its antioxidant effect. Along with oxidative stress and the high intraocular pressure, blood vessel inadequacy has been proposed as a contributor to glaucoma, especially in normal tension glaucoma. Ginkgo biloba has been shown to increase blood volume and velocity of blood flow in the eyes of healthy people. In patients with normal tension glaucoma, studies show that it improves visual field loss. These encouraging findings will hopefully lead to more research. Coleus for Scoli is one of 200 varieties of the plant Coleus found around the world. The therapeutic ingredient in Coleus for Scoli is found in its root, which was used originally in a paste for treating a variety of disorders, including cardiovascular conditions, because of its vasodilating effect. In vitro studies show its significant antioxidant properties. In clinical studies involving both animals and humans, a specialized preparation of Coleus for Scoli applied directly to the eye was shown to reduce the intraocular pressure by increasing the intraocular circulation and decreasing the aqueous humor inflow into the posterior cavity. Benefits were observed about an hour after application and remained significant for at least 5 hours. Coleus for Scoli has also been used in the treatment of hypothyroidism, a condition where the thyroid gland underperforms. Interestingly, hypothyroidism is a proven risk factor for glaucoma. Magnesium has long been recognized as nature's calcium balancer. Previous studies have demonstrated that calcium channel blocking drugs offer benefits for some glaucoma patients. Armed with this revelation, researchers at the University Eye Clinic in Basel, Switzerland, evaluated the effect of supplemental magnesium on glaucoma patients. Magnesium at 121 milligrams twice per day was administered to 10 glaucoma patients for 1 month. At the conclusion of the study, the results substantiated that magnesium supplementation improved the peripheral circulation with an accompanying beneficial effect on the visual field in the patients with glaucoma. Magnesium also has the ability to suppress the sympathetic nervous system. This is a reputation that earned magnesium a credit in cardiology, acting as an anti-adrenergic, meaning that it can block the fight or flight reaction, which causes the pupil to dilate and put added pressure on the drainage angle in the anterior chamber of the eye. The trace mineral chromium has won credit beyond stabilization of blood glucose levels by improving the focus of the eye and lowering the intraocular pressure. Selenium has also been associated with glaucoma, and zinc with other vision disorders, including age-related macular degeneration. Palmitoyl ethanolamide, or PEA, is a lipid compound and is made in the body in response to tissue damage and inflammatory signaling. PEA is also found in egg yolks, soybean, peanut, and other foods. PEA binds cell surface receptors that have broad effect on cellular function, and its demonstrated anti-inflammatory, analgesic, neuroprotective, and retinoprotective effects through a synergistic response with the endocannabinoid system. PEA is said to have an entourage effect, where it can directly increase the endocannabinoid receptor activation through various mechanisms, such as the inhibition of enzymes responsible for the degradation of endocannabinoid ligands. Some evidence suggests the PEA levels in eye tissues, which are responsible for regulating intraocular pressure, are lower in glaucoma patients than those without glaucoma. In a randomized double-blind crossover trial in 42 patients with primary open-angle glaucoma or ocular hypertension who were being treated with timolol eye drops or whose intraocular pressure was between 19 and 24 mmHg, the addition of 600 mg of oral PEA per day for 2 months led to a significant reduction in the intraocular pressure when compared to the placebo. A randomized controlled trial in 32 patients with normal tension glaucoma found those who were given 600 mg of oral PEA per day for 6 months had improved visual field parameters and reduced intraocular pressure compared to those who received no treatment. In a crossover trial in 40 patients with primary open-angle glaucoma or normal tension glaucoma who were being treated with topical prostaglandin analog, the intraocular pressure decreased and tests of retinal function improved after supplementation with 600 mg of PEA per day, in addition to the topical treatment for 4 months. Also, quality of life scores increased during the time that the PEA was taken. PEA administered as eye drops appears to be beneficial as well. The use of eye drops containing 0.05% PEA twice per day, along with standard anti-glaucoma medication for 30 days, was found to improve the health of the ocular surface tissue in a controlled trial in 30 glaucoma patients, 15 receiving PEA and 15 receiving the placebo, indicating the PEA may help to prevent and treat the negative side effects related to chronic glaucoma treatment. Small amounts of the pineal hormone melatonin are synthesized in the retina of humans and most other animals. Melatonin is a powerful antioxidant, and it can help to reduce oxidative stress in the eye. In studies of animals with induced glaucoma, researchers found that placing melatonin in the anterior chamber of the eye reversed the negative effect of ocular hypertension on retinal function, and it diminished the impact of ocular hypertension on retinal ganglion cells. These results indicate that melatonin could be a valuable resource for treating glaucoma. Rootin is a bioflavonoid from the citrus family. It's demonstrated the ability to lower intraocular pressure when used in conjunction with standard drugs. Moreover, experiments have revealed that orally ingested rootin is capable of reaching the eyes. It's well documented that the active ingredient in marijuana lowers intraocular pressure in people with and without glaucoma. Marijuana has been tested as a glaucoma treatment in its smokable form and also as pills and eye drops. Patients and doctors see potential advantages of all formulations, but with some caveats. Doctors are quick to point out the negative impact of frequent smoking on lung health and the mood-altering effect of marijuana on cognition and motor skills, which could interfere with carrying out daily activities. Also, the intraocular pressure lowering effect of marijuana only lasts for 3 to 4 hours. The pills and the eye drops contain the active ingredient in marijuana, THC, or tetrahydrocannabinol, and this is effective in some people, but others find the side effects of THC uncomfortable. As for the eye drops, it's not been possible to develop a compound that provides a sufficient dose of THC to the inside of the eye. Another effect of marijuana, it lowers blood pressure, and this could be a problem in glaucoma. As mentioned earlier, there's growing evidence that poor blood supply to the optic nerve could contribute to glaucoma. Therefore, marijuana's effect on blood supply to the eye might cancel out any improvement in the intraocular pressure lowering treatment. More research is planned to study THC as a potential therapy for glaucoma. Research findings show that physical activity can have a long-term beneficial effect on ocular perfusion pressure. Ocular perfusion pressure is a measurement derived from intraocular pressure and blood pressure, and this reflects the status of blood vessels at the optic disc. This is an important finding given that low ocular perfusion pressure is a risk factor for glaucoma. The benefit appears to be related to cardiovascular fitness. In a study of over 5,500 men and women, researchers questioned participants about the rate of earlier physical activity 15 years previous, and then they tested their intraocular pressure and blood pressure. They found an association between higher levels of activity and a 25% reduced risk of lower ocular perfusion pressure. Older research shows that caffeine can cause a temporary increase in intraocular pressure. The increase lasts for about 2 hours. Researchers looked at dietary histories of nearly 80,000 women in the Nurses' Health Study and over 42,000 men in the Health Professional Follow-up Study to determine whether repeated caffeine intake throughout the day would sustain the intraocular pressure elevation and increase the risk of developing primary open-angle glaucoma. They found no such association between the overall caffeine intake and the increased risk of primary open-angle glaucoma. Green coffee and brewed coffee contains antioxidant compounds, and these have neuroprotective effects. The antioxidant property of green coffee comes largely from the phenol chlorogenic acid. Other antioxidants in coffee include caffeic acid, quinic acid, and ferulic acid. Researchers report that green coffee has the strongest antioxidant property, followed by instant coffee. Antioxidant activity decreases during roasting by about 50 to 90%. The antioxidant property of instant coffee are partially related to the production during the roasting of the free radical scavenger APV, which is a zinc chelating substance formed from chlorogenic acid, sugar, and proteins. The neuroprotective effect of chlorogenic acid has been demonstrated in cell cultures of rat retinal ganglial cells, where the researchers found that the chlorogenic acid produced a concentration-based inhibition on the oxidative stress-induced neurotoxicity. For more on herbs, supplements, and natural treatment plans, check out my website.